Okay, it's Dr. Matt Harkness coming to you with the clinical pearl for TMJ craniofacial patients. So today I'm talking about occlusion or bite. So when the patient brings their teeth together, they should make equal contact on the right side and the left side. So there are two things that you want to do, and this usually works pretty well when you notice that one side isn't making contact. So today our patient is not making contact on the left, so just quickly you want to check it. What I like to do is just take two tongue blades, open a little bit, and you want to have the patient bring your teeth together. Yeah, good. And so kind of bite down on them. And so what we're going to do is this side isn't making contact, relax a little bit. So it's sliding out. Okay, open. All right, so that was a very quick assessment, but also too, it's important to ask the patient, do you feel like you're making contact? So in this case, we're going to pretend that the patient's saying, oh, I'm not making contact on the left. We confirm it with the tongue blade. So we want to restore that even bite. So there are two things you want to try. So the first thing is to release the muscles, the masseter muscles and the intraoral muscles on the affected side. So that would be on the left side. And then we also want to stretch that side. So first thing, all right, I just have the patient open about halfway, insert your thumb, okay, close and just relax your teeth. And I just start up at the top of the masseter and just kind of apply pressure and slowly go along the length of the masseter muscle to release that. Okay, and then after I do that, I say tongue up, open and close once. Yeah, and close. Okay, so keep the tongue up, open and close. Good. So that's always kind of the reset, like after I do any work, mobilization, soft tissue release. After I finish, I always have them tongue up, controlled mouth opening, open once or twice just to kind of reset and relax the jaw. Okay, so that's the first thing we did. We release intraorally. The second thing we do is we want to stretch that left side. So remember, when we side glide the mandible to the right, it's going to stretch the left. So it's always good to use some tongue depressors, tongue blades. This provides a nice little kind of, the teeth can glide on this easily. So open a bit, rest your teeth on there, and just slide your chin to the right, not your head, so just kind of relax. There you go, and back to the center. Good, again to the right, and back to center, and one more time, to the right, and back to the center, okay? So remember, when you're slide gliding to the right, or to the left, if you stack the tongue blades, if you use more, and it will stretch it more, the stretch will be stronger, okay? So just to recap, check and see if the occlusion, which side is not making full contact. In this case, it was on the left. So what we want to do is massage the thumb intraorally 2 or 3 times to massage it. And then we want to stretch it by slide gliding the chin to the right. And you can start with just 1 or 2 tongue blades. And to make the stretch stronger, stack some and slide to the right. And then, of course, after we check, open, close, yeah. And, okay, kind of bite down. And I pull, voila, it's fixed. All right, thank you for watching. There are always exceptions to this, so if it doesn't work, there are some other things we can try on another video. Always email me, but most of the time that is going to work pretty well. Thank you for watching. Be sure to share this with a friend, and we'll see you next week.